Hello, today I'll be doing my disease comparison part 5. My two diseases were genital chlamydia and yellow fever virus. So I'm just going to go over a little bit about the two of them. So first is chlamydia trachomatis, which is genital chlamydia. It's a gram-negative bacterial agent that's transmitted by sexual contact. And the symptoms are a lot more severe in women. Usually you really only see urethritis in men, but then you see a wide variety of symptoms in women from mucopurulent cervicitis, endometritis, pelvic inflammatory disease, and other somewhat long-running symptomatic uh, symptoms. Um, for the symptoms, they're usually a result of an immune response and not actually a result of an endotoxin or any other part of the chlamydia bacteria, and those are systematic from humoral and cell mediated mechanisms, so that's antibodies and cell to cell immune responses. And treatment for chlamydia trachomatis includes antibiotics such as azithromycin and doxycycline. This usually only takes around 2 weeks, and for uncomplicated cases, but complicated cases such as ones that include PID or pelvic inflammatory disease may require longer regimens or changes in antibiotics. There are also some antibiotic resistant strains of chlamydia trachomatis, and those do require a little more thought into what antibiotics to use. Prevention methods for chlamydia trachomatis include safe sexual practices, and early identification and intervention are really good and important for preventing some of the more uh, unfortunate symptoms. In terms of pathogenesis, chlamydia trachomatis is a intracellular bacteria, so it infiltrates the cells of the genital tract and induces an immune reaction. As you mentioned earlier, a lot of the symptoms do come from that immune reaction. Uh, some of a little more detail about the infiltration. The bacteria hides inside of vacuoles inside of the host cell, which helps it evade detection. And again, the tissue damage and inflammation is due to the host response after the bacteria is exocytosed. Major virulence factors for chlamydia trachomatis is MOMP, or chlamydial major outer membrane protein, and polymorphic outer membrane autotransporter proteins. And these have a couple of different uses, but the main uh, something that plays a major role in infection are type 3 secretion systems, or TTSSs, and those help the bacteria to get inside of the cell, which is what causes how the infection. Um, asymptomatic patients are also a major component of pathogenesis. This isn't really on the cellular level, but if an asymptomatic patient has sexual relations with someone who doesn't have the infection, it will transmit even if they don't have symptoms. Next, for epidemiology, in 2020, 128.5 million new infections worldwide were aged among adults from 15 to 49 years old. So in 2020 it was a little bit lower because of the COVID-19 virus, but it's still a pretty good general baseline. Um, in terms of the gender disparity in other demographics, uh, 4% of women and 2.5% of men are seen with chlamydia, and so there's a slight tendency towards women. This could also be because of the testing. You know, the symptoms for women are generally more severe, and so women are more encouraged generally to test for chlamydia versus men. Other groups include young individuals, so teenagers, gay and bisexual men, pregnant people, and racial and ethnic minority groups, though any sexual active individuals at risk, so protection is important. In 2018, chlamydia trachomatis was the most prevalent STI in the United States, though there did seem to be a slight decrease from 2018 to 2022, which can be seen as a positive. Treatments for chlamydia is in WHO's Global Health Strategies, which is nice because it's aiming for a 50% reduction in new cases by 2030. We'll touch a little bit about what kind of strategies these will be, but generally it is something that we are working towards. And so for the next disease in our presentation, we have yellow fever virus. And it's not a bacteria like chlamydia, it's a positive single-stranded RNA virus, and it's part of the flavivirus genus. And it's widely considered to be one of the prototypes of hemorrhagic fever. Yellow fever virus is primarily transmitted through the Aedes aegypti mosquito, though there are other mosquitoes that do carry the disease. Transmission cycles actually do vary on location, and it uses the aforementioned mosquito as a vector. So sylvatic or monkey to human transmission is actually usually seen in a different location from human to human or urban/intermediate cycle transmission. And yellow fever does see a wide variety of symptoms. There are asymptomatic patients, just like chlamydia, but as mentioned earlier, it is a kind of a prototype for hemorrhagic fever, so it has that fever, headache, jaundice, and muscle pain. And there's no specific treatment for yellow fever virus at this moment, only supportive measures for those specific symptoms. So, anti-fever, jaundice, or so you have any other supportive treatments. Prevention for yellow fever includes minimizing exposure to the mosquitoes, so bug spray or not staying outside at nighttime, and there is also a very highly effective live attenuated vaccine available. And a little bit about the pathogenesis. So after a mosquito bites you, the viral glycoprotein E binds to a specific unknown cellular receptor, so we don't know what it is right now, but that initiates the internalization of the virus through endocytosis. And you can kind of see it on the diagram over here, where you can see the virus attach and it gets sucked into the cell. This is just a general diagram for flaviviruses, so it's not entirely accurate, but it is a pretty good baseline. And so, like other viruses, host machinery is used to translate and assemble viral proteins. So we have the yellow fever virus kind of hijacking our ribosomes and other such endoplasmic reticulums and recreating more viruses. And as for the specific exit strategies so that the yellow fever virus can proliferate, they're somewhat undefined, but we kind of have narrowed it down between either fusing with the plasma membrane and being exocytosed, or being secreted via the secretory arm autophagy, which is pretty interesting because that means when the cell finds and targets the virus, it is targeted for secretion rather than degradation, which is somewhat odd. So, as mentioned earlier, many of its symptoms are attributed to immune function. So, the systematic cytokine response or cytokine storms are often the major driver in tissue damage and the symptoms that we see when someone gets infected. And for example, the yellow fever virus often finds itself in the liver, and so we see a lot of liver damage as it replicates in the liver. And finally, for the yellow fever virus, we have the epidemiology, and so it poses a pretty big health threat in the region that it affects, and it's mainly seen in Africa and South America. On these diagrams here, you can see that there are 34 countries in Africa and 13 countries in Central and South America that are identified as being endemic for yellow fever or having endemic regions. The WHO actually estimates that 84,000 to 100,000 cases, severe cases, occur annually in Africa, with corresponding fatalities ranging from 29,000 to 60,000, which is quite high. Generally, the sylvatic cycle or the monkey to human cycle occurs in Africa, and the urban cycle or the human to human cycle occurs in the Americas. And it's not transmitted directly between humans, of course. There's the mosquito vectors. People who are in significant risk to yellow fever are travelers, and this could be because they haven't lived in there and the genetic makeup is predisposed to acquiring the yellow fever virus. And so vaccination is required for all travelers aged 9 months and older, and anyone visiting areas with yellow fever risk. And so I have chosen yellow fever for the disease that I found for this assignment, And I think this because, as a disease that is considered a prototypical hemorrhagic fever, yellow fever has quite severe outcomes and a high mortality rate in cases of severe disease. In areas with inadequate vaccine coverage, you can see death rates increase drastically. In On this diagram right here, we see the projected case of death when there is a mass vaccination versus when there is not vaccination. This is estimated, of course, because we have done mass vaccination, but it is estimated that the death rate would be much higher without vaccinations. And kind of in contrast to that, genital chlamydia does have severe complications, especially in women, because of PID and other diseases if left untreated, but it is less likely to result in death, and if found early, it is generally not fatal. And another part of the justification is how much of a public health threat it is. And so, yellow fever mainly only affects Africa and South America, but outbreaks do pose a significant health risk to everyone present there. And if a person travels countries, they can bring that virus with them, and mosquitoes could possibly transmit it there as well. And addressing yellow fever on the global scale can help prevent a lot of widespread morbidity if it spreads or seasons change or mosquitoes can travel. In contrast, genital chlamydia does actually affect individuals globally, but it doesn't usually result in large-scale outbreaks or epidemics like yellow fever does. And just to see on the right, we've actually seen a decrease in chlamydia trachomatis over the course of 2019 and 2020, and it's somewhat leveled up recently. This is likely because of the lockdown in COVID-19. So, education and preventative testing are the best ways to have an impact on chlamydia trachomatis, but this impact is a lot more difficult to measure as compared to yellow fever because of the asymptomatic nature of many cases. Yellow fever, on the other hand, does have that live attenuated vaccine, and it is quite easy. It's a lot easier to measure the impact of that as compared to just testing. So speaking of testing, the last justification for yellow fever funding is the prevention and treatment. So once again, the vaccine for yellow fever is available and highly effective in preventing the disease. Furthermore, usually only a single dose is necessary for an entire lifetime prevention, so it's a very cost-effective intervention. You only need to give the vaccine once, and mass vaccinations are very effective in that. Currently, the global stockpile is actually insufficient to provide vaccinations for everyone threatened by yellow fever, which helped lead me to this decision, because I do think that having a vaccination for everyone that can be threatened is a very important part of this. In contrast, testing and treatment for genital chlamydia is very important. However, long-term preventative measures such as vaccination are actually not available for this disease yet. There has been lots of studies and lots of testing for how to make a vaccine for genital chlamydia. However, there has not been development quite yet. And for treatment, there's no direct treatments for yellow fever at the current time, and there's really only the supportive treatments to manage the symptoms. And meanwhile, chlamydia does have antibiotics which help prevent transmission and resolve symptoms. So once a person gets yellow fever, you can't really cure it, versus when someone gets chlamydia, there are some options you can take. And so specific areas to increase funding for yellow fever include education, vaccine initiatives, and surveillance tracking. About education, so topics for that education can include transmission rates or vulnerable areas, and the preventative measures you can take to avoid yellow fever. And so I think this would be important because the lack of awareness about a vaccine can lead to hesitancy or refusal to get vaccinated, and those vulnerable individuals in endemic regions are vulnerable to infection, which is not good. And also, learning about the mechanisms of vaccines can help prevent misinformation. There was a lot of talk recently in the COVID pandemic with anti-vaccinations, and I learned a lot about this in my immunology class, so I thought this would be good to implement. Um, so again, for vaccine initiatives, inadequate vaccination coverage leaves populations at risk of outbreaks and often contributes to the spread of disease due to the urban cycle of the mosquitoes, so human to human. Um, Providing funding to the creation of vaccines will also be a cost-effective and efficient method to lower transmission rates. Once again, not everyone has a vaccine, as we talked about a little bit in the last slide. There's not enough in the stockpile. And lastly, for surveillance and tracking, so funding for detecting early outbreaks of yellow fever and supporting rapid response efforts will be very effective. Again, the urban cycle or human to human cycle of yellow fever means that if one person has yellow fever, then if a mosquito bites them and then bites another person, that can transmit yellow fever. Um, and the World Health Organization actually treats detection of yellow fever as an emergency in endemic regions, as because there is risk of further spread if there's one person detected. And some estimated positive outcomes for funding yellow fever include decreased incidence rates, improved herd immunity, and prevention of outbreaks. So, as for decreased incidence, 90% of vaccinated individuals actually develop neutralizing antibodies within 10 days of vaccination, so it's very effective, especially for travelers. And the presence of neutralizing antibodies for YF is actually very closely related to protection, with seroconversion rates, which is a rate for determining the effectiveness of vaccine, being at 95%, which is very good. As for the improved herd immunity, this sounds kind of odd because there is no technical human to human transmission. You can't give someone yellow fever virus, but due to that human to human with a mosquito intermediate, pure immunity is relevant in vulnerable populations. So if someone isn't able to receive the vaccine, so infants or people with medical reasons, or people with under the age of 2, which have less effectiveness with the vaccine, they can't really receive the full protectedness of them. So having the entire population immunized is very important to preventing spread of yellow fever. And for prevention of outbreaks, education, surveillance, and faster response can once again lead to that mitigation and awareness of yellow fever cases. So if we know there is a yellow fever case in an area, we can kind of create countermeasures and predict we have a better prediction for outbreak locations. And once again, because of the mosquitoes being the main vector of transmission, um, if we know an area has a bunch of mosquitoes, we can kind of predict if they're going to move or any of the specific parts of the city will have mosquitoes with yellow fever. And so, although I did support yellow fever, of course there are some adverse outcomes for not supporting general chlamydia. And so, of course, that is increased transmission. So, the best funding methods for general chlamydia are education and regular testing. So, without adequate education, we might see an increase in transmission rates because of unawareness of sexual protection and how general chlamydia spreads and what kind of symptoms they have, and that could lead to higher incidence and prevalence of the disease, which is not good. And regular testing in sexually active individuals actually increase the likelihood that asymptomatic patients are found. So those asymptomatic patients are really causing the spread of further transmission. So if we are able to find an asymptomatic patient, that allows them to get treated and prevent them from spreading chlamydia further, which would not be the case if we don't have regular testing. And there also are complications. So there's PID, pelvic inflammatory disease. So not supporting preventative testing, once again, might lead to some individuals who, if we funded regular testing, who would have been diagnosed and treated, not being diagnosed and treated, which would lead to the long-term complications and the severe side effects of contracting chlamydia. And for education, the detrimental stigmas of STI testing actually might lead to undiagnosed infections. So once again, if we have education about STI testing, that kind of destigmatizes it. It kind of exemplifies the importance of STI testing. If we don't have that, it might lead to have some people being uncomfortable with getting tested, and having an undiagnosed infection. And once again, undiagnosed infections have pretty severe consequences, pelvic inflammatory disease being a main one, due to the long-term effects on overall well-being and possible fatality, especially in terms of ectopic pregnancy. And that is all. So this is my references. I got all 30, so I got it all.